CDEMA typically seeks to ensure that resources that are provided to the organization in lieu of the emergency response to these events are passed on in full to our member states, particularly those that have been impacted. Over time, what has happened is that given the collective group of actors who have responded to the incidents, there is a tendency from time to time for there to be some resources remaining coming out of the emergency response phase. And these are resources particularly provided by the diaspora or members of the Caribbean community, private donors, individuals in their homes in their respective countries, as well as corporate donors, as distinct from funds we would get from international development partners and donor agencies. What we then do is, as we are leaving the theater of operations, we seek to leave something with our member states in lieu of their early recovery efforts. And we coined the term a legacy project in that regard. So in the past, in Haiti, where we have responded to the earthquake in 2010, we, as CARICOM, did some work in repairing health facilities and other facilities there using funds we garnered. In fact, over the last couple of weeks, we have engineers working there to do repairs to a school in in Jeremy. We had approached two projects in Haiti after the Hurricane Matthew impact, where we were able to do a school in Lacaille and we had pledged to do a school in Jeremy. But given the elections that took place thereafter, we were asked to withdraw and then to come back in at a later date. And so we're doing that as a legacy project in support of Haiti following the Hurricane Matthew impact. In this case, coming out of Irma and Maria, with the funds we collected from the public and some of our corporate partners, we're passing this on to several countries. To Antigua in response to Barbuda, where we've provided resources to assist them with sustaining their feeding program for those individuals who were displaced from Barbuda. And that is over, I think it's a 2-week to a month period. We're providing them some additional resources coming out of monies received from the government of South Africa to address another priority which they are to come back to us to outline as part of their recovery efforts. In the case of Turks and Caicos, we assisted them with the repairs to one of their I think it was a primary educational facility, helping them with resuscitating the computer lab, one of the schools that was damaged, with the funds we received there. In, I think it is in BVI, we've done the autism center, repaired the autism center, and we've provided them resources to repair an emergency shelter facility going into this hurricane season as part of the legacy project in that country. Our work in Dominica is a lot more extensive. It is based on the fact that we would have received roofing sheeting from a private sector donor out of Jamaica, Tankwell, to support the early recovery. And with that, we received additional resources from the government of Canada to supplement the roofing sheeting and to address the needs of those individuals in the indigenous community, in particular the Kalinago territory. We've added some resources from those we collected from the public as well, to try to see if we could repair as many roofs as possible in the Kalinago territory. And so that's one of the main legacy projects we're undertaking in Dominica.